What up, everybody? It's your boy Albatross. So, when you're studying medicine and surgery, there's two aspects to it: preclinical and clinical. Preclinical is where you learn theory in classroom, then clinical is where you actually take what you learned in classroom and you apply it on the wards on patients. So I'm here at Lusaka Apex Medical University talking to 60th year medical students, asking them about their different experiences between preclinical and clinical. So kindly introduce yourself, tell me what course you're pursuing and what academic year you're in.
My name is Donna Chilembo. I am a 60th year medical student, MBCHP.
So my name is Robert Magazi. Everybody calls me Bobby. I'm a 60th year medical student and I'm pursuing MBCHP, medicine.
Okay, I'm Joe Yav. I'm doing Bachelor in Medicine and Surgery and I'm going to my 7th year.
My name is Justin Dade, and I'm doing medicine and surgery, MBCHB, and I'm doing clinicals.
So obviously you've gone through preclinical and clinical. What is the difference between preclinical and clinical based on your experience?
So for preclinicals, it was more about the theory, yeah, and then the clinicals is more practical. It's more like you really get to understand what you're reading about, because like earlier you're just trying to pass, but then clinicals you're trying to understand.
Okay, preclinical and clinical. Clinical, I can say it's the workload. The workload is a lot. Clinical is also a lot, but preclinical it's way more involving in terms of willpower, and clinical you have to just be committed and disciplined because you have to wake up every day to go to the hospital that you don't even want to be at. So, and preclinical it's a thing whereby you're reading, you feel everything is imaginary. Like what you're reading is just, it's just a flex. I'm doing medicine. That's when clinical it comes in with, this is getting real. I really have to apply what I was studying in preclinical. So it's really involving.
All right, so for preclinicals, this is where you have more of the theoretical aspect of academics. So this is where you're going to do your basic physiology, basic anatomy, basic chemistry, physics, all that stuff, right? So you only get to read about them and then you're given assignments and stuff, but you don't really get to have a practical aspect of it, okay? Not that much anyway. There are practicals and skills labs that you have, but then that's just to give you a feel of what's to come, which is the clinical.
Okay, so preclinical is more of theory, though there is a bit of practical, where there is dissecting and yeah. Then if we talk about the clinicals, the clinicals it's more of like practical, like seeing patients, like trying to apply the knowledge that you had learned in preclinical. Yeah.
Okay. So based on your experience with clinicals and preclinical, which one between the two has been most challenging for you?
I would say they have levels. They both have some sort of difficulty, but overall I would say preclinical is more difficult because you don't really have a picture of what you're studying, okay? But then for the practical aspect, you have a picture of it in that you get to see exactly what you read about in the books and you see it in person.
Preclinicals is more difficult. It's easier to pass with clinicals because it's like you're there,
I think preclinical, because there is more of like more studying. There is a lot of work that you need to study. It's like you're assessed on everything, But when it comes to clinical, it's more of cases that are common, like things that are common. So there is that exposure to the common conditions that are common, like the conditions that almost will be presented at the hospital.
So knowing what you know now, based on your experience, 6 years of medical school, going back in time, would you still do medicine?
Not at all. Not at all.
Any reason?
No particular reason, but I just wouldn't. It's a noble, profession. It's nice. I love doing it. I don't regret doing it. But if I had the chance, knowing everything I've gone through, I wouldn't.
Personally, I don't think so. No.
Any reason why?
Because of the time. I feel like I've wasted a lot of my life in medicine, and I feel like if I did pursue other things, the capital I would have been able to get from that other career would have taken me somewhere further.
So, based on
Not just that. Plus, jobs right now in the medical field are looking quite scarce, so I think I'm scared of my future. Yeah.
Going back in time, I would still do medicine, except it wouldn't be my first choice this time. It would probably be maybe third after maybe engineering and something else that I won't say, right? But not my first.
that being said, somebody wants to do medicine out there. Any advice for them?
Someone wants to do medicine.
Yeah.
My guy, be strong. Be strong. Just adapt that culture to study every day. You don't have to be smart to do medicine. You don't have to be. Don't be scared that I'm not smart enough and stuff like that. Just study. Learn to study every day, and I'm telling you, you'll get it.
If you have a good sponsorship or people that are willing to sponsor you, I think you can go with it. Yeah, it's a course that you can do, but you need to have patience, because it will teach you on how to have patience. You need to practice to have patience, yeah, because it's a long course. It requires a lot of time. Yeah.
Go for it. If it's your passion, if you're really passionate about it, go for it. But if you're in it for the money, this is not the place to be. Yeah.
I would say they should just go for it and do what they feel like they can do, because maybe where my mind was at and the opportunities I had and the support I had when I was starting may be different from what they have. They could have support from home. They could have opportunities to do it. Okay, finances may be right. So maybe they could be in a better position to do medicine than I am, because 6 years is a lot, right? Or 7 years for certain schools is really a lot. So you really have to plan ahead as guardians, as parents, okay, for such type of things in life. So maybe depending on the circumstances that are surrounding your families, I guess I would advise them to go for it if they can manage.
All right. Bobby, thank you very much for your time.
You're
I wish you
welcome.
all the best.
You're welcome.
So there you have it. You heard their experiences. Follow for more content.